So Megan, for years, people with diabetes and members of Congress have been fighting to get insulin prices lowered. While in office, former President Trump promised lower insulin prices as well.
But the new administration has put a pause on the executive order and others. Working for you, our Kelsey Anderson explains the impact on insulin users across the nation.
Well, to put it simply, diabetes is an expensive disease. On average, one vial of insulin can cost about $250. And most type 1 diabetics need more than one vial of insulin every single month. That price, a 1,200% increase over the last 20 years. Taylor Smith has been living with her disease for nearly 30 years. She has to go to the pharmacy every 3 months to get her prescription of 9 vials of insulin. She says thankfully she's got great insurance and doesn't have to pay out of pocket. But if she did, her 3-month supply would cost more than $3,000, a number she says is higher than she's ever seen.
It feels like I'm being penalized for something that I did not choose and I did not cause. And so if prices did go down and were more reflective of, any other prescription that many Americans pick up and don't feel that huge dollar amount at the checkout, it would feel a little bit, it would feel like we were finally being recognized as a large portion of the country that is being really underrepresented.
According to the American Diabetes Association, last July, the Trump administration released several executive orders on prescription drugs, one of them requiring federal qualified health centers to pass on discounts they receive for insulin to their patients. When the Biden administration took over, they put a pause and review on all of the Trump administration's executive actions on health care until March 22nd. So what happens next is still unclear. Now, in that blog, the American Diabetes Association says they will continue to monitor this situation closely, and they say they are going to continue also to be working with the administration to drive policy change. As for Smith, she says seeing a lowered price in insulin would be a weight lifted off the entire community's shoulders. Working for you, Kelsey Anderson, WRTV.